was the last time? Where did we stop last time? Saan tayo nag-stop last time? Recap na lang tayo, and then I think we stopped somewhere sa hemoglobin. Okay, let's just have a recap. Okay, so we all know that the blood is a connective tissue. It is red in color. The arterial blood is red in color due to the oxygenated hemoglobin. So the functions of the blood, it's bringing transport. It has to do with transports of oxygen, some molecules, and then it is also for the protection. It has also to do with the protection of the body, particularly in the process in hemostasis. It has also to do with regulation of the control of pH, acid balance, osmotic pressure. So the components of the blood, we have two components, main components of the blood. We have the plasma, which is the liquid portion, and then we have also the formed elements, which is composed of the whole blood and the fragments. So the plasma, let's go here to this one. Okay, so the plasma is about 55%, is more than the is about 55%, and 91%, 90 to 91% is composed of water, proteins, 7%, and other celluloses, 2%. So we all know that the proteins here that we mean, these are the albumins, the globulins, and the fibrinogen. Fibrinogen is one type of a clotting protein. No? It is a clotting factor. So the other solutes will be the ions, will be in form of cations and anions. You have there the nutrients, like the glucose, the proteins, some waste products of metabolism. You also have there the gases, the oxygen, the carbon dioxide, and some regulatory substances such as enzymes and hormones. Thus, the formed elements are the platelets, the white blood cells, and the red blood cells. So we all know that the red blood cells are more compared to the white blood cells, which is composed of 5 types, like the neutrophils, the lymphocytes, monocytes, eosinophils, and basophils. Okay, so erythrocytes, these are the red blood cells. This is the most numerous type of formed elements. This is more than the white blood cells in volume. It has no nucleus, and it has no nucleus, and there is absence of cytoplasmic organelles, and it is biconcave in shape. This contains oxygen through the carrying protein, the hemoglobin. So this plasma membrane is strong and flexible to be able for the blood to squeeze into the pores, when it needs to go to the tissues. So the lifespan is 120 days. And where does the old red blood cells and damaged red blood cells go? They are going to be removed by the macrophages in the spleen. So this is the form of the red blood cell. So you can see there. So the RBC physiology, we already discussed about this. There is a condition called hypoxia, where there is a low level of oxygen in the blood. So what is going to happen? What will be the response of the body? To form more new red blood cells in the red bone marrow. It is the decrease of blood oxygen, that is the condition called hypoxia, is now going to stimulate the kidney to produce the hormone erythropoietin, and the hormone erythropoietin will in turn stimulate the red bone marrow to produce or increase the production of red blood cells, thereby increasing the oxygen in the blood. So this is now the development of the different types of the formed elements, which is coming from the stem cell or the hemocytoblast. So we know we have the granulocytes, granular leukocytes or white blood cells, and we have agranulocytes or agranular, those does not contain granules. So there are three granulocytes or three white blood cells that contains the granules. You have there the basophil, the eosinophil, and the neutrophils. And we also have the granulocytes, which does not contain the granules. You have there the lymphocyte and the monocyte. Okay. So I think we stop there, no? Okay, let's go now to the hemoglobin. So this is what I have already mentioned from the start. The hemoglobin is the one that carries the oxygen. So in male, the normal hemoglobin level in the blood is 14 to 16 grams, while the female is 12 to 14 grams. So the male has, in compared to the female, has higher hemoglobin because testosterone found more in male, and this stimulates the synthesis of erythropoietin. The hematocrit there, this is the number. So the hematocrit is the number of red blood cells. So take note, this is the number of red blood cell in the whole blood. So when centrifugation, when the components of the components of the blood is going to be centrifuged or to be separated in the process called centrifugation that is usually done in the laboratory, the separation of the components of the red blood cell that is separated from the other components or the other parts of the components of the other parts of the whole blood, that is what you call as hematocrit. Okay, so the normal hematocrit level in the blood is 45 to 52% in males and 37 to 48% in the female. So there is what we call as hemoglobin RBC in RBC disorders like anemia and hemophilia. When you say anemia, I think we all know what we mean by anemia. We mostly hear this like, oh, I'm anemic. I easily get let's say dizzy, or you are pale. No, this is because of the low. This is because of the low hemoglobin. Okay, this is because of the low hemoglobin in the blood. So hemoglobin in this aspect, this one is decreased, no? Especially really decreased from the normal. So there is a critical level of hemoglobin where it really needs to be corrected or it needs to be attended. Like say, for example, mostly females, we have our menstruation that can be compensated by we have our menstruation or losing blood, but that is not really losing blood. There are some components of the menstrual blood that is not only blood that is being lost, but there are also some parts wherein when there is a preparation, remember there is a preparation of the uterus, preparation for implantation, and because there is a frustrated uterus, like there is no implantation, so everything that is being prepared in the uterus is being sloughed off. That goes together with the menstrual blood. So that means it is not actually all blood that is being lost there. So in anemia, especially in females, a little percent only is being, let's say, reduced with especially lalo na kapag excessive bleeding yung sa babae, of course there will be blood loss, but it could be compensated by the body physiologic response of the body. And of course we can also enhance it by eating by taking supplements like iron supplement, or let's say by eating some food which is rich in iron. In a condition called anemia, that is where the hemoglobin level will go down and the compensation is very slow. So it could lead to this condition because hemoglobin will go down. That is why it could manifest as dizziness. No? Sometimes people will have, especially if it is not corrected, it could also lead to where there will be, let's say, naghahabol ka ng hininga, little bit, not really difficulty, but a shortness of breath. No? So that's why we have to think of, it could be that hemoglobin level is low. And remember, what is carried by the hemoglobin? It is the oxygen. No? So that is anemia. So again, there is a low level of hemoglobin in the blood that could lead to anemia. Another condition is hemophilia. This is an inherited bleeding disorder in which the blood will not clot properly. So it has a problem with the clotting factors. This is caused by the mutation of of one of the genes that is providing instruction for making the clotting factors. So what happens here? It could cause bleeding. It could cause bleeding following when there is injury or following injuries or surgery. So kaya kapag may hemophilia, medyo mahirapan kapag nagkakaroon ng operation because there is a deficient in the blood clotting factors. Okay? So there will be low level of blood clotting factors, and this is an inherited bleeding disorder. So this is the hematocrit. So when you're going to centrifuge the whole blood here, all the components are going to be separated. So this will now be the plasma, and this will now be the hematocrit. This is the volume, percentage of volume of blood sample that is occupied by red cells. Okay, so if you're going to look at the picture, you have there, during centrifugation, this is the supernatant plasma. Then you have here the white blood cells, which is the buffy coat here composing of the white blood cells and the platelets. And this is the packed RBC, or the packed red blood cell. Okay, so that's with the red blood cells. Let's go now to the leukocytes, or the white blood cells. So the white blood cells is composed of, remember, the white blood cells is composed of, there are 5 components of the white blood cells. And the white blood cells per se, which is the leukocyte, is about 5,000 to 10,000. This is the normal level of white blood cells in the circulation. The leukocytes, or the white blood cells, has nucleus. They do not contain hemoglobin because they did not carry oxygen. But this is the one that will live, that is more, that is going to combat the pathogen by phagocytosis or engulfment, and it has to do with the immune response. Okay, it plays a very important role in the immune response of the body. So this is less numerous, but compared to the size of the red blood cells, they are larger than the red blood cell. And most of the components of the leukocytes will only live in a few days, except for the lymphocyte. Okay, so lymphocyte is one part. This is the granular, one component or one type of the white blood cell, and this can live for several months or years. Okay, so that is the lymphocyte, the component or a type of white blood cell which can live for several months or years. All the others could live only in a few days. Okay, so those are the leukocytes. So the leukocytes is going to be transported to the body, will reach the site, like say for example the site of infection, by the process of chemotaxis. So when you say chemotaxis, this is when the neutrophil or the other white blood cell components are going to attach to the chemicals that are being released by the microorganisms at the site of infection or injury. So the attachment there of the component, or the white blood cells, will be to the chemicals, because the microorganisms here will be releasing the chemicals. So doon mag-a-attach yung mga white blood cells. So that is the process called chemotaxis. The process wherein the shape of the process wherein the shape of the white blood cells, or the process wherein the white blood cells is going to deform to be able for the white blood cells to squeeze through the pores of the capillaries to be able to reach the injured area, is called diapedesis. So this is now the time when the white blood cell is going to leave the circulation or the bloodstream in the process of deformation, so that it could penetrate the pores of the capillaries para makarating siya sa site of the injured tissue. Okay? And that process we call as diapedesis. Okay? So again, what anyone can differentiate the process of chemotaxis and diapedesis? Anyone from the class? Anybody? If you say chemotaxis, what happens to the white blood cells in this process? Anyone? Are you awake? Anyone from the class? Those who are awake, anyone, can you explain what chemotaxis is in your own words? Naintindihan? Yes, Sigmund.
In my own words po, ma'am, yung mga microorganisms po, nagre-release po sila ng chemicals in where the other components po ng white blood cells, doon po sila uma-attach to locate the site of injury po, ma'am.
Okay, very good. So, when you see chemotaxis, that is the adherence of the WBC, nag-attach doon sa chemicals that are released by the microorganism at the site of the infection or the injury. So, thank you so much, Sigmund. So, diapedesis naman, ito yung nagde-deform siya. Ito yung nag-change yung shape niya by elongating to be able na makakasqueeze siya doon sa pores sa capillaries. And that is to be able to reach the injured tissue. So, ito yung process na ito na the WBC will leave now the circulation. Okay? It is now going to leave the circulation to squeeze into the capillaries. So, that is diapedesis. Okay, so we talked about the different types of the white blood cells. We have two types, no? We have the granular and the second one is agranular. So when you say granular, ano nga uli yung granular? They contain granules, no? They contain granules. The cells contain granules. So there are three types of granular leukocytes. We have neutrophil, eosinophil, and basophil or basophil. Bahala ka na kung paano baliktarin yung acronym na yan as long as the three components are there, no? So first let us discuss the neutrophil as the first type of granular leukocyte. Okay. So neutrophil, this is the most numerous leukocyte or white blood cell. This is the most numerous leukocyte. The nucleus of the neutrophil is containing 3 to 5 lobes. So under the microscope, when you identify that this type of white blood cell, you can see that there are 3 to 5 lobes containing the nucleus has 3 to 5 lobes, no? So it has 3 to 5 lobes. It will only also contain the Barr bodies. Barr bodies, these are inactive sex chromosomes, or the X chromosomes only. Remember, the chromosomes is composed of X and Y. It is composed of X chromosomes that are inactive, and these are only the Barr bodies are only found in the female because this is important in the sex identification. Okay? So this is the first line of defense. Neutrophils will immediately arrive, will quickly respond to bacterial infection. So, mabilis siya yung pinakauna na pupunta doon sa site of injury or to the site of infection. So, it is the one, it is considered as the first line of defense, particularly to bacterial infection. Siya yung unang mag-i-increase. And it contains lysozyme. The lysozymes, these are substances which is increased, which you can find. These are substances that you can find in or that is carried by the neutrophils. So you can find them in the tears, in the saliva. This is where you can find them. No, so that is why saliva is also contained. It's like an antibacterial agent. No, because of the presence of lysozyme in the neutrophils. And when you stain the blood, it will stain neutral pink to blue. So under the microscope, you can see that the color of the neutrophils is neutral pink to blue. So that will be the identification. So under the microscope, again, it is composed of 3 to 5 lobes, and it will stain pink to blue. Okay, so that is the shape of the nucleus, or those are the nucleus. No, this is 1, 2. This is composed of, remember, this is only 3 to 5 lobes. If you see something like this, this is these are the lobes of the neutrophils. So you can see here, itong mga yan, yung mga para siyang dirty look, yung parang mga spots dyan, no? Yung mga spots dyan, these are the granules. Itong mga to. These are the granules. So that's why it's called granulars, because the nucleus contains the granules. Okay, let's go now to the eosinophils. The eosinophils, this is the second most numerous granulocyte, composing about 2 to 4% of the total number of the white blood cells in the blood. No? So the granules also will contain lysozymes, peroxidases, to be able to destroy some intruders or some pathogens in the blood, like microorganisms. So it will stain pink in acidic dyes, and it is going to phagocytize antigen-antibody complexes. So antigen and antibody complexes, these are immune complex. No, immune complex that is normal. They are there to respond to infection or to respond to certain microorganism. But when antigen and antibody complexes is increasing, it could also, the increase of these complexes could also destroy the tissue. So we'll be able to maintain the balance so that it could not destroy the tissue. The excess of that should be phagocytized, and this is by the white blood cells called eosinophils. Okay, so again, it will phagocytize antigen-antibody complexes. It will destroy, so an increase in eosinophil could indicate that there is parasitic infection. Okay, so if it is increased, it could also indicate parasitic infection, or it could destroy certain parasitic worm, no? And then it could also be increased during allergic reaction. It combats the effects of histamine during allergic reaction. So again, eosinophil will increase in number when there is parasitic infection and there is allergic reaction, because it is the one that is going to fight against the microorganisms, or it is going to fight certain parasitic worms. So there are some parasitic infection that is causing the increase of eosinophils. So this is the one responsible for combating those types of infection. So the eosinophils, the nucleus is often here bilobe. So this is the bilobe nucleus here. Yan. Okay, so this is the whole total eosinophil. The basophils is about 0.5 to 1%, and this is the least commonly encountered granulocyte. So it has coarse large granules which will stain dark blue, which is now going to obscure or obstruct the S-shaped nucleus. Dahil nga dito, coarse kasi at large yung granules, kaya yung S-shaped na nucleus na o-obstruct niya. The basophils, the granules of the basophils will contain anticoagulant which we call as heparin. Okay, so it liberates anticoagulant called heparin. And it has a similar function with the mast cells. So the primary function here also is another function aside from liberating the heparin. It will also synthesize and release the slow reacting substance of anaphylaxis. Okay, so that is the basophil. Ito yung basophil. You look at the structures, these are the coarse granules. Ito yung mga granules niya. This is obstructing the shape of the nucleus. The S-shape of the nucleus. Okay, so another basophil. Another picture of the basophil. Okay, so those were the granular lymphocytes. Let's go now to the, granular leukocytes. Let's go now to the non-granular or agranular leukocytes. Okay, so the non-granular leukocytes, this is composed of lymphocytes and monocytes. Let's discuss first the lymphocytes. The lymphocytes, this is the most numerous from the agranular sites. So from the two, siya yung pinakamarami. So it's about 20 to 25%. It contains minimal cytoplasm and it lacks specific granules. That is why it is called agranular. And it is non-phagocytic. So it does not phagocytize microorganisms. Lymphocytes are produced in the bone marrow and in the lymphoid tissue. Remember, they are very important in the immune system because they play a very important role in the immune response of the body against infection. Lymphocyte during acute viral and chronic bacterial infection will go up. Okay? So if there is an acute viral or chronic bacterial infection, the lymphocytes will go up. When you say chronic, that means paulit-ulit, okay? Very chronic, paulit-ulit. So chronic bacterial infection, the lymphocyte will grow up. And the lymphocyte is a type of a granulocyte that is going to produce antibodies. Okay? You will understand more of this when we reach the lymphatic system. Okay, so there are three types of lymphocytes. You have there the B cells. The B cells are produced by the bone marrow, and you have there the T cells, which is produced by the thymus, and then you have there the NK cells, or what you call as the natural killer cells. So those are the three types of the lymphocytes. This is the cell, and you have there yung nucleus, and you have there the surrounding the nucleus, you have there the cytoplasm. Ito. Minimal cytoplasm surrounding the nucleus. This is the nucleus. Okay, so again, you have there the lymphocyte. So there is a clear cytoplasm there surrounding the nucleus. So malaki yung nucleus niya. Okay. The second agranular lymphocyte is the monocyte, which is about 3 to 8%. So this is kidney-shaped nucleus. This is the largest. Siya yung pinakamalaki, no? Largest of all the formed elements. But it will only stay in the blood for 3 days. This is the type of white blood cell that is going to transform to become macrophage, which is capable of phagocytosis. Okay? So monocyte will transform to become macrophage, which is capable of phagocytosis. So lifespan is only or will stay only in the bloodstream for 3 days. What is the shape? It is kidney-shaped. It has a kidney-shaped nucleus. So it is a kidney-shaped or horseshoe-shaped. Okay, so it is a horseshoe-shaped or a kidney-shaped nucleus. So remember, di ba ang horseshoe parang ganyan? Ito din, oh. Para din siyang horseshoe shape. Para din siyang kidney-shaped. So these are the different shapes of the different types of nucleus. So you can see there, no? Sa illustration na to, nakikita mo yung mga granules dyan. Ito yung mga granules, no? Those are the granules in the cell. Okay? So the different types of white blood cells there. Okay. So ito yung mga different types of white blood cells. Let's go now to the platelets. Okay, so platelet, it is derived from the megakaryoblast, which is derived from the stem cell or the hemocytoblast. And then it will now divide to become the megakaryocyte. When the megakaryocyte will break up, it is now going to produce the platelets. Okay? So the breakup of the megakaryocyte, this will now become the platelets. So the normal level of the normal level of platelets in the blood is between 150 to 400. So remember, it has to do with blood clotting. It is enucleated. It is a membrane bounded. It has membrane bounded fragments of cells. So again, they came from the megakaryocytes. It is having a biconvex discoidal shape, and this is approximately 2 to 4 micrometer in diameter, and they often appear as clumps. So ito yung mga ito. Yan. Yan. So if there is a decrease in platelets, yes, Gioni. Yes, Miguel.
Napindot lang po, ma'am. Sorry po.
It's okay. The decrease in platelets could lead to bleeding. And if it is less than 150,000, and if it's not corrected, it could lead to hemorrhage. Okay? So that is why it is very important in a condition where there is dengue fever, because the virus of the dengue is going to attack the platelets. So what will happen is that it is going now to go down. So that is why it is closely monitored because of the danger of bleeding. Kaya kapag mayroong pasyente na nagkaroon ng dengue, they will be often, they are mostly or usually monitored for signs of bleeding. Like say for example, nagpapasa-pasa or nagkakaroon ng bleeding of the gums, or they will be asked, no? There will be monitored, nagtae ka ba ng dugo or something like which leads to bleeding, because yun yung danger, ina-attack ng virus ang platelets with dengue. Okay? So that is monitored. Aside from the platelets, before we continue with the platelets, remember that in dengue also, there could be a danger of increased blood viscosity. That means, this is just a clinical correlation to this, guys, no? Para lang maunawaan ninyo. There will also a danger of hematocrit, increase of the number of hematocrit. So that means when there is hematocrit increase, what will happen? Diba, hematocrit is the volume of red blood cells. Magkakaproblema yan kasi magka-clump-clump yung mga red blood cells, which could lead also to clotting formation. So mangyayari, magkakaroon ng clot formation. So what will happen? Kasi nagka-clump yung red blood cell, so there could be a formation of clot that could impede the circulation. So kaya, minomonitor also ang hematocrit, especially when there is dengue. Okay, let's go back now to the platelets. Again, a decrease of platelets, if it is not corrected, it could lead to hemorrhage. Okay, so that is about the platelets. Okay, so these are the platelets. Okay, these are the platelets. So what is the role of platelets in hemostasis? Saan ang platelet? So when you say hemostasis, this is the body's normal physiological process that will stop the bleeding at the site of injury while maintaining the normal blood flow. So they are there. So that is why the platelets are there to prevent the blood loss by clotting. Platelets also have an incompletely understood role in maintaining the integrity of the endothelial lining of the blood vessels. The platelet will react to abnormal surfaces when there is a bleeding or a bleeding wound. So the platelets, when there is a wound or there are injuries to the blood vessels, they are going to be activated, no, to form a plug para hindi magbe-bleed. So the mass of platelets that will increase, kung dadami siya, it will be called thrombus. The problem with thrombus is it's not only if it is going to be detached from the circulation, it could now lead to blocking it will be blocking the blood circulation, the flow of the blood. Okay, so that's a problem when thrombus formation will happen. So the release factors, the platelets will also release factors that will participate in the clotting cascade. Okay, and in fibrin formation. Fibrin is clot. Okay, so those are the functions of the platelets. So let's go to this one. Ito yung platelet plug formation. Platelet plug. Paano na po-form siya? So platelet plug formation, okay, to maintain hemostasis or to prevent even bleeding, what happens is that there will be a signal. There is going to be a signal that is going to, wherein the platelets are going to be activated. Remember, there are times when di naman natin alam, there is a tear of the blood vessel, there is a rupture of the blood vessel. Of course, it needs to be stopped, no? Hindi natin alam, there every day we bumped into something, no, that can cause to a damage to the blood vessel. Kahit na close yung ating skin, no? Or let's say there is a cut in the wound. So, di ba kapag there is a cut, we have really very small, tiny blood vessels there, no, on the skin that could be injured. So, what is the problem? What is the problem there? It could lead to bleeding. So, to prevent that one and also to maintain hemostasis, there would be what we call as platelet adhesion. So, what will happen is that we need the von Willebrand factor to be able to connect the collagen to the platelets. So there will be platelet adhesion that will occur when the von Willebrand factor will now connect the collagen to the platelets. Okay? This platelet release reaction is the release also, the platelet release reaction will now also release ADP, thromboxanes, and other chemicals that will activate now the other platelets. Okay? It will now activate the other platelets. So, to be able for these platelets to be connected to each other, remember, there is a fibrinogen receptor which is now going to connect the fibrinogen to be able for them to be able for the platelets to connect to each other. So that is why fibrinogen is very important. Remember, fibrinogen is a type of clotting factor. Okay? So this is now the protein that is going to connect one platelet to another platelet to be able for the platelets to come together to form a plug. So kapag they come together na, all of them will come together here. They will be connected by the fibrinogen. So there will be platelets here connected by the fibrinogen at the receptor site. It will now create the plug, thereby preventing bleeding, thereby producing or thereby maintaining maintaining the integrity of the blood vessels. So naintindihan nyo guys? So that is how bleeding is being stopped at the site of injury. So remember the von Willebrand factor, you have there the receptor, you have there, this is the von Willebrand factor. So these are the receptors where the platelets are going to adhere to each other. Okay. So this is where the clot is being formed. Ito na yung tinatawag nating clot formation. Okay? So, when there is injury to the blood vessel, the connective tissue will be exposed and chemicals will be released to activate the inactive clotting factor. Okay? So, the active clotting factor now is going to the calcium. There are some components. Remember calcium here. Calcium is a very important factor because this plays a major role in activating coagulation factors. Okay? They are now going to be activated, and the active clotting factors, this is now going to activate, like example, the clotting factor to form prothrombinase, which will in turn convert prothrombin to thrombin. Okay? Again, if there is an injury to the vessel, it is going to expose the connective tissue, releasing chemicals to be able, like chemicals, like example in this form, the calcium, which plays a major role in activating coagulation factors. So this is now going to activate the clotting factors, and the active clotting factors is now going to form prothrombinase, and prothrombinase is very important to convert prothrombin to become thrombin. Okay? So thrombin now is going to convert fibrinogen to fibrin. So this will now be the clot. The clot now will be called fibrin. Okay? This is during clot formation. Okay, so this is the process of the formation of the clot. So there are conversions, no? There are conversions coming from which is activated by prothrombinase to become the clotting factor there, prothrombin, will be converted to thrombin, and thrombin now will convert fibrinogen to clot or fibrin. So again, that is the clot formation or the formation of the clot. Ito naman sa 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 um, ano naman na ito sa illustration naman na ito. This is the process which we call as fibrinolysis. This is now the breaking of the clot. Okay? So once the damage or the injury of the blood vessel is already done, once the damage is already healed, not done, but once the damage of the blood vessel is already healed, the clot there needs to lyse or needs to break. Okay? So the clot there is going to break. So what happens is that the thrombin and some tissue plasminogen activator is going to convert plasminogen to plasmin. And plasmin now is going to, ito ang magbi-break ng fibrin. So the process there of breaking the clot or the fibrin is called fibrinolysis. Okay? This will happen to break the clot, or else the clot will stay there. So that is when the damaged tissue is already, this will happen when the tissue is already repaired. Okay? So the clots there needs to be dissolved. So the dissolution or the breaking of the clot there will be called fibrinolysis. So that is when the blood vessels or the injury is already repaired. Okay? So did you get it, class? Did you understand the processes of platelet plug formation, clot formation, and fibrinolysis? Okay, let's go now to the different blood types. So you have there the ABO blood groups. Okay? So we have there the ABO blood groups like the type A, type B, type AB, and type O. Okay. So remember, on the surface of the red blood cells, so ang key roles dito are the red blood cells and the plasma. Yun ang dapat nyong unawain para kapag magkaroon kayo ng blood typing na sa laboratory ninyo, maunawaan ninyo bakit may type A, may type AB, may type B, may type O. Okay? So let's go now to the red blood cell. On a type A patient, or on a type A patient, on the surface of the red blood cells will be antigens. Depende kung anong type yung dugo ng tao, no? So, if you are type A, the antigen that will be present on the surface of the red blood cell will be antigen A. Okay, type A, antigen A. But in the plasma, the antibody that will be present in the plasma will be antibody B. Okay? So again, on the surface of the red blood cell will be antigen A. In the plasma, the antibody will be anti-B antibody. Okay? In type B blood, the antigen present on the surface of the red blood cell will be antigen B. But the antibody present in the plasma will be anti-A antibody. Okay. While type AB, the red blood cells, the surface of the red blood cells will contain antigens, both antigens A and B. But there are no anti-A nor anti-B antibodies in the plasma. Okay, so there is no antibodies there. with a type O blood, sa surface ng red blood cell, wala kang makikitang antigen dyan. Okay? But, there will be anti-A and anti-B antibodies in the plasma of type O. Okay? So, remember that. Now, a person needs blood transfusion. So, what is the protocol when we do blood transfusion? First, the patient's blood should be compatible with the blood of the donor. So that means, if I am type A, I need a blood transfusion. The blood donor should also be type A. If I am type B, the blood donor should also be type B. Okay, but there is what we call as universal donor, which is type O. Okay? So, that means, me as a type A or type B or type AB, I can receive type O. Pwede akong mag-receive ng type O na blood. But then, for safety purposes, this can only happen when there is no available type A or type B. So, in emergency cases where there is no type A or type B, or type B blood types, pwedeng gamitin ang type O. But that is only on cases where wala na talagang makita na type A, type B, or type AB. Doon ka na pupunta sa type O. That is only in emergency cases. But as much as possible to refrain from having allergic reaction or anaphylactic reaction due to a wrong blood type being transfused, kailangan talaga, kung pwede, same type blood. Okay? So type O is a universal donor, and type AB is a universal recipient. Okay? Guys, could you please excuse me for a while kasi medyo nangangati lang yung lalamunan ko. Just give me 5 minutes lang.